Hey everyone, so thought I would give you a quick 4-week post-op update on my tibial osteotomy and cadaver cartilage surgery on my patella and trochlea. So again, I'm at week 4, and as far as doctor visits go, didn't have any doctor visits this week. I did have a little chat to see if I could please start driving. Mine is on the right knee, unfortunately, so super annoying. But other than that, I had PT again this week, which is going to be increasing to 2 to 3 times a week. Really, he wants me 3 times a week, but he said 2 times a week is okay due to me being past my PT allotment for the year, so I'm paying out of pocket. Updates on range of motion. So last week we had to stop at 60 degrees because that's what the doctor had as limitations at that point, but PT recognized I could have gone much further. This week we got to 72 degrees, which he was happy with. I was honestly a little disappointed with. I thought, I could have been able to go further. However, there was pain with that. So from that standpoint, everything went well. Range of motion, again, he's happy with, so I'll take it. I did ask, when I could kind of, walk with the crutches maybe, put my foot down. That was a big fat no for anytime soon. Other than that, I love that my PT, he increased the repetitions of some of the things I'm already doing, and on the leg lifts we added a little bit of weight on the ankle. I was able to do the regular leg lift, sitting of course, and then laying on my side leg lift and butt lift. So those were good. The best part was he also added some core stuff in there for me and got creative with that. I will upload my program type thing, just a short blurb of me doing it so people can kind of see. It's hard to describe, but basically the 3 things we kind of added this week for core so I don't lose my mind were laying on my back, cross my braced leg over my other leg, and then dig my heel of the injured brace leg into, the other leg, so I'm not using my knee or my quad or anything, and use my core and butt to just squeeze and lift that up off the ground. It's only a couple inches of that. You don't even hold it, but that was effective. I did 50 of those and definitely felt it. Another really interesting thing that I never even thought of was, again, crossing that braced leg over the other leg. And this is basically eliminating you using your muscles or your quads and knees to try and lift, but doing V sit-ups. So that was really nice. I almost didn't think I could do it, but I totally could. Did 3 sets of 10 of those. And then the third one was very similar, except that brace leg over the other leg was raised, and then did like I would, the medicine ball of, swapping sides and doing sit-ups like that, but no medicine ball this time. I'm sure next time he'll incorporate that to make my life difficult, because he wants me to feel like I get a good workout. I complain when I don't. And so those were very effective and great ways to kind of change things up to where you can still do some of those core exercises, when you can't do a plank and things that you're used to. So it's all about adapting and adjusting and finding the right PT that is willing to think outside the box and realize and understand that you still want to work out all these other areas and find someone who's creative enough to do it in a safe manner. So props to my PT. And other than that, My next post will be just some examples of my PT exercises, going through them so people can kind of see them if you're a visual person. Hope this helps. Other things going on this week, frustrations are, I'm ready to throw the crutches out the door, kind of hit my limit, mainly because the stupid things keep suctioning on the ground. Can I get an amen? And if it's not pulling at me and wanting to stay where I land with the crutch, it is coming completely out of the suction, and then you're just metal on floor, which recipe for disaster. No big mishaps yet, knock on wood, but some of the creative things that my engineers at work told me were to drill a hole in the bottom of the plastic piece so there is no suction capability. I am working on that. My husband got home from being out of town today, so you can bet your rear that I will have him with a drill bit in the bottom of that crutch this weekend, because I'm over it. Beyond that, thankful for my family and my hubby for being my Uber. And yeah, so hope this helps. Have a great day.